So moving on, you'll see on your programs that we're now going to have a presentation from Tanzania. And Charles Campion Smith, who very sadly can't be here because he's got COVID, is leading on that program, which is the next stages on from this wonderful DFID program that Carolyn Collins led on behalf of PCW. Charles, are you there?
I am here, yes.
No, we've got Charles is there, bottom right.
And you can hear me?
Hear you loud and clear. Yes, over to you, Charles. Thank you.
Excellent, thank you. Yes, as George says, we've always talked about sustainability in the work we do. We had an opportunity 2 years ago to sponsor 6 early career nurses for a grant from THET. It was approximately £1,000 per nurse. We chose to use that money to buy protected time. The emphasis of the program was on improvement and leadership development. So for the second phase, 2 of the what we call the master fellows, the fellows from the first program, were then cascading those skills down to 4 of the colleagues, 4 new fellows. And we're delighted that they decided to make the focus of their improvement work palliative care in the town of Sokoine down in southeast Tanzania, and linking with the existing palliative care team that was there already. And they're going to tell us a little bit about what they've been doing. We've got 1 or 2 slides to sort of intercalate, and I think Michael's going to show us a conversation we recorded yesterday.
My name is Faraja Kilewa, and I'm from Southeast Tanzania. I'm an established fellow of National Fellowship 2, and I'm so honored because I have participated in National Fellowship 1 in 2022, and together with me, I'm with Mr. Juma Makota, who is also an established fellow. And together we have been able to train 4 other new fellows who we have been coach them and mentor them on quality improvement and leadership sessions. Thank you so much.
Thank you. Juma Makota is another of the Nursing Now Fellowship Master Fellows. He's doing the second program, and and with Juma on the right is Peter Masinde, who's a pharmacist at Sokoine Hospital, and he has been leading the Sokoine palliative care team for some time. Tell us a little bit about how Juma and Faraja and the fellows have worked with the palliative care team you have already.
Thank you for having that moment. I would like to share what I'm doing training from the General Coach School of Human Faraja. In supporting palliative care service in the hospital. First year is would be sharing skills that we have obtained from them. But also the second best we obtained from human Faraja is simplification in task and activity distribution. But also another part is performance assessment of the team been certified with the support of human Faraja together with his team. But also the spirit of palliative awareness in and outside the hospital, means in the hospital and the community. I think that's some of the best tips and supports we have been accumulating and taking from the general human balance to the team.
I'm going to stop you there for a minute, Peter. I know that you and Juma and Faraja and the fellows have been doing some work to help people's awareness about palliative care and help you recognize patients. I think you've done work with your colleagues in the hospital, and you've done some work in the community as well. Can you just tell us a little bit about that, just for 2 minutes, about the work you've done in the hospital with your colleagues and the work in the community?
Okay, thank you, thank you. It's assessment of patients, especially on the first use there, you ask me. The support you have been obtaining from Yuma Palliative, the team is much more on identification there. An assessment of new patients here, especially with the palliative care in the wards. But in the community, has been helping in sustaining more community workers and other staffs in training the patients who are in the home, who are at homes or in the communities, joining in the gym. So I think it's not a little bit support we have been sustaining youth in the such.
Thank you. Yeah. I know that you've shown me some pictures in the past of your team working with patients both in their own home and in the hospital. Have you any stories about patients who you've been able to help? Perhaps I'll ask Faraja that first. Can you think of any stories of where you've been helping patients with the knowledge you've had?
Yes. There have been quite a lot of stories from patients whom we are attending at community. Since most of the patients we have been seeing seem to be that they were isolated, the relatives, the community had nothing to do to them. So one of the things that the patients gave us as an explanation is their appreciation of the service that we are giving. Like, thank you so much for you came to visit us to give us a new hope. This is what they always tell us. If the encourage them and telling them their diseases is not the end, they still have a lot to do. There is something as professionals we can do to them and to the community and to their families.
Thank you. I think with this project, you have shown us that you have used the improvement and leadership skills you gained on the course, but you've been able to use them focused on palliative care. I don't know if you want to say anything about the leadership and improvement part of what you've learned from the Nursing Now Challenge Fellowship. Has it helped you in changing and improving the systems, do you think?
Yes, so much. First of all, it was quite challenging for us to join the palliative care team. Mr. Peter Masinde would be a witness. Since we complete the 1 week training of palliative care, we used our leadership skills to meet with the management of palliative care at the hospital level. Mr. Masinde, our aim and our goals, but they would not admit to receive us because they wanted us to show that we are on the same side. We have the same goals and we all want to improve palliative care.
I think that's good to hear that. And I'll ask Peter. Peter?
Yes, hello.
How have you found Juma and the new fellows working with you with this idea of service improvement? Has that been something that's been useful for you as you've developed your team?
Okay, yes. Yeah, it's been a good support, a good found the movement of the team, not the movement of the team. As some of them say, first has helped us in moving more the service in the open the outside the I can say, and stabilizing the team more, especially on the task performance and even distribution of activities and tasks within the team. And yes, all that.
Juma, can I ask you, do you think now your other colleagues in the hospital, the other nurses and doctors, have any different understanding about palliative care? Do you think Has been any change there?
Yes, they understand more because they have but they have knowledge very last time, but now they are knowledge on palliative care increased.
I think you've done some work and some teaching about using morphine. Is that right?
Yes, yes.
And were your other doctors and nurses a bit afraid of using morphine before, do you think?
Yes, yes.
And have you brought about some changes there?
Yes, you great changes because the previous times they are afraid to now they are very very brave and very knowledgeable about the uses of morphine.
I know you were saying, Peter, that when you talk about palliative care, you've talked about the 4 parts of palliative care that you've been telling your colleagues. You want to say something about that? The 4 ways you assess the patient.
Yes, yes. Can I also add some of the comment on that? And the 4, I think, and the 4 basic of political activity is just care me, psychological, physical, spiritual, and social things. Of which we are living in, I think, as a team together, have been shown in attending those basically with especially with basic assessment, and once it comes to the matter of skills provision or education provision to medical staff, other medical staff in the community. Still there is many on that 4 basis of palliative care. So the things is like that, and it's moving very good. That's right.
It's very good to hear that you're using the idea of physical, psychological, social, and spiritual with your colleagues, and that they are understanding that. I know you've been doing the work in the community, Faraja. I think what you said about giving patients hope was very important. Do you think your other colleagues in the community are learning that they too can give patients hope when they have disease limiting their life?
Yes, I think they're doing the same, although we are doing a continuous awareness providing, because it's our duty to provide hope. Community workers are helping us, visiting the patients, and we need to update them now and then and remind them this is an important part of palliative care. So I think we are doing it, and we are continuing to remind them.
That's good. I'm really pleased to hear you are reaching out into the community. That's so important because that's where many patients are.
Thank you, Michael, for putting that.
Okay, Charles, thank you very much indeed. We salute you all in Tanzania. We're very proud of what you're doing. Thank you, Charles, so much. Do you have some comments, Charles?
I just think that a couple of points Faraja said just echo the toolkit, isn't it? That your care, interest, and attention are very powerful therapeutic goals, and that there's always something you can do. And I think for me, that was always one of the striking bits of the toolkit. And it's just so nice to hear Faraja and her team taking that message out to the village health workers. The last quote we saw was from a home-based care worker. So spreading that message, I think, is so important. So I'm very proud of what they're doing, and I'm pleased to see they're applying the theoretical training in leadership and quality improvement in a very practical way.
Michael, and I just emphasised that this was a government hospital which didn't have any morphine or palliative care until we had the opportunity with a DFID grant to go out to Tanzania in 2019. do the training. And this really was to demonstrate 5 years on that this has continued. There is enthusiasm and growth in a government hospital. They have challenges because most of the work is voluntary. There will be budgetary things, but there was morphine, and Peter, who's secretary of the palliative team, has championed that availability there.
Thank you. Yeah. And also, can I pay tribute to Carolyn Collins, who I know has joined us for the conference, and you're very welcome, Carolyn and Richard, for her leadership of this very exciting, extremely challenging program. And it's absolutely wonderful to see how it has progressed, and as you say, Charles, the sustainability of the whole program. So thank you to you all, congratulations, and thank you, Charles.